Thank you, Lotus, and thanks to all the presenters and to the Wellbeing Blueprint for hosting this session today. My name is Naomi Campbell. I use she, her pronouns, and I'm the director of the Legal Empowerment Program at the Right Question Institute. And we are a nonprofit organization. We actually work in many different fields and across the globe. And we have developed an educational strategy, which we share with those folks who are working in many different systems and fields. And this educational strategy is based around two skills. So fostering the development of asking better questions and participating more effectively in decisions. So you may be asking yourself, why questions and why decisions? Those are two seemingly simple things, simple skills. But what we found through our work in many different communities, and what the argument we make is that asking questions is a foundational skill for thinking, learning, and taking action. That the ability to focus those questions on key decisions helps people become more effective and strategic. That people become more engaged, they understand more, and they discover their own power. And these two skills are rarely deliberately taught. And so that is our work, is to figure out how to teach these two foundational, seemingly simple skills. And I'll tell a quick story about where this actually comes from. So many years ago, our co-founders were working in Lawrence, Massachusetts, primarily immigrant community north of Boston. And they were working with parents, and one of our co-founders is from Puerto Rico, was a parent herself in Lawrence, Massachusetts, Luz Santana, and they were working in a dropout prevention program. And the parents that they were working with kept saying to them, well, we don't go to the school to advocate for our children because we don't even know what questions to ask. And so they thought, wonderful, like we know what to do. We're going to give you a script. We're going to give you a list of questions. You're going to be able to go into the schools, advocate for your children. And of course, what happened was that the parents would take that list, but then would need to know what to ask in any other situation they were in. So they realized from these parents naming this long overlooked barrier to their participation, that it was really about building people's skills so that they could participate and ask questions no matter the setting or situation. And what the parents also taught them was that they could share these skills with the people in their communities and use them in different areas. So they say, you know, I shared it with the parents in the housing authority. I didn't use it here, but I used it in the community health center. And so they were really showing how universal these advocacy skills really were. And that original work with parents led to our work in many different fields. What we do is we encourage people who are working in systems to transform those systems by doing their work in a different way, by doing their work in a way that creates space for people to ask their own questions, gives them the process for asking those questions, builds those skills. So we've done work in healthcare, having patients improve healthcare outcomes and partner more effectively with providers by coming up with their own questions before a provider visit. We've done work in school family partnerships, work in classroom education around the world. And then I, of course, partner with legal professionals, social workers, other direct service providers, and give them a strategy to work with their clients in a different way. And so all of that from the original insight by parents in Lawrence. Just stepping back a little bit, the way that we see the impact of teaching people how to ask their own questions and use those questions to advocate for themselves, people feel a stronger sense of agency as they navigate these many different systems that impact their lives. They're better able to advocate for themselves and families and hold decision makers accountable. And then frontline service providers are able to partner more effectively with the people and communities they serve. And I just want to give some examples of how people, when they're learning these skills, have changes in what they know, how they feel, and in what they're able to do. So I'd like to just share a couple of quotes from people. So this is from Nelida in Sacramento, California, and she said, "You're better prepared, you know what you want, and when you know what you want, you can look for a way to get it." So she's able to identify her goals by asking questions and then can use those questions to get what she needs. This is from Alicia in Boston. She said, "It helps you advocate for yourself without feeling overwhelmed or inferior to what someone might have. I wasn't intimidated anymore. It makes you feel like I can do this. So changes in how people feel, in their confidence, in their ability to advocate. And finally, this was a session participant who had a son with a hearing impairment and said, I didn't know I could ask questions at the school. That's what we hear a lot from people. I didn't know I was allowed to ask questions. But by doing that, I was able to get my son the services he needs. So just some more concrete examples of how this has been applied in different fields. We've seen legal professionals use this strategy to help prepare families for individualized education plan meetings. So when they're advocating for special education services in schools, preparing their questions ahead of time and understanding when key decisions are being made. Social workers have prepared youth who are homeless or at risk of homelessness for both court appearances and meetings with attorneys. Students who were in a GED class learned this strategy from their teacher and were able to advocate for themselves at the welfare office, where they were constantly being told, you know, you didn't fill out this form right, you did this wrong, and they were able to use these questions to hold those decision makers accountable. And a community, this was actually a community organizer who used this strategy to help a community who was advocating for violence prevention programs after a school shooting. So it's been used in many different fields, many different ways. That's actually something that we love about the Full Frame Initiative and the Wellbeing Design Principles, is how it connects people working across many different systems who care about well-being. And just to close with some connections that we see to the Wellbeing Design Principles, we talk a lot about agency and how people feel agency and how that is connected to well-being. And so the way that well-being is described in the Wellbeing Blueprint really resonates with us and our work. We look at where this comes from, so communities naming overlooked barriers to their participation, and that has guided our work. That was the original mistake that we made, and the original lesson that we learned was from those communities. We look at transforming partnerships with providers who are working in different systems. And we look at how to leverage existing infrastructures. So instead of creating new programs and services, how do you actually transform the way that people are working to center well-being? So I think that might be my time, but I'll just leave my email address here. You can register to access free resources at our website. We also do trainings and love to hear from folks who are doing work in many different fields. I'm naomi.campbell@rightquestion.org. Thank you.